I think the sort of unique part about Shield was actually at the time, and probably still is the case, and we talked a little bit about this in class recently, that it was one of the first trials that actually incorporated AI machine learning into the structure of the trial. And so the idea behind that study was we took basically across the course of 6 months, everybody in our department had their data screened by this machine learning model. And it sort of, you can kind of think of it as flagging like high risk folks. And what we did with that information was that we used it basically to triage folks to extra supportive care with their physicians and their clinical team. And we did that in sort of the gold standard in like a clinical trial or in healthcare evidence is a randomized control trial. So we basically, half the patients were randomly selected to have extra visits with their doctor, and the other half kind of went through kind of a standard treatment where they saw their doctor once a week. And we basically found that by using this automated triage, we could cut emergency visits and hospitalizations in half. And we actually, the most recent thing that came out of this project was we found that the costs that came as a consequence of the care also got cut in half.